Hello, this is Mark Swanson here at Gulfcoast Ultrasound Institute, and today's hot tip will be using ultrasound for shoulder dislocation and also to confirm successful reduction. For this examination, the linear transducer or the curvilinear transducer is going to work. Today I've selected the curvilinear transducer. I have the patient sitting straight up on a stool facing the machine, and I'm going to be scanning posterior to anterior on this patient. So I'm going to go ahead and locate the patient's scapular spine. I'm going to drop just inferior to the scapular spine, and I'm going to locate the scapula. I'm going to slide a little bit more lateral. At this point we can clearly see the scapula, our glenoid fossa, the infraspinatus, and also the patient's humeral head. I'm going to ask the patient to go ahead and rotate externally and internally. We're going to watch the humeral head rotate within the glenoid. And what we're looking for here, stop right there, that's perfect, is a straight line from the scapula all the way across. We'll see glenoid and then of course humeral head. Now since we're scanning posterior to anterior, and the majority of shoulder dislocations are anterior dislocations, it's important to remember that this humeral head here is going to displace down more posterior on the screen. Again, we're looking for this straight line, scapula across, there's our glenoid, and there's our humeral head. It's also important to remember that you can always scan the opposite shoulder for confirmation. That's your hot tip for the day. Now you give it a try.